Welcome to WWDMD, a podcast that is all about peeling back the curtain on what clinicians really think and feel as they work with others. My guests, clinicians, who are also sometimes clients themselves, risk their vulnerability as they publicly share their emotional reactions to their clients, disclose their challenges in doing the work, and reveal their personal backgrounds. I'm Dr. Meyers. I'm a psychotherapist in New York City with 30 years of practice experience, specializing in anxiety and depressive disorders, as well as sibling relationships and family systems. I'm also a professor of social work at Malloy University on Long Island. I see this as a journey of self-reflection for not only our guests, but you, because with each episode, I'm hopeful that you will learn something new about yourself. Please note that any discussion of case details have been modified to protect the privacy of our clients.
What would Dr. Meyers do?
Hey everyone. So today's conversation might just shift the way you think about therapy. We're talking about ketamine. Yes, that ketamine, and how it's being used in psychotherapy to help people heal from depression, PTSD, anxiety, and emotional pain in powerful new ways. So once, ketamine was known mainly as an anesthetic, but it's now showing promise for treating all forms of disorders or various forms of disorder that we'll get more clarification on. And I'm being joined by Dr. Hudson Elmore. He's a clinical adult psychiatrist who integrates ketamine-assisted therapy into his practice, and he's the medical director at Being Health in New York City. He's going to unpack what it's really like inside a ketamine therapy session, how it works, and what it means for the future of mental health. And I'm really so glad you're here and joining me in this conversation. Welcome, Dr. Elmore.
Thank you so much for having me, and thank you for the introduction.
Yeah, of course. So it's really interesting because ketamine we're hearing much more about, and we tend to hear about the tragic side of ketamine use. And I wanted to really learn more because I'm not well informed about the use of ketamine in therapy, and I'm really curious about what it looks like, who's a candidate, and all that kind of thing, and taking us through how it's applied and integrated and how decisions are made about who it's used for. So I'm just going to start with how you first became interested in using ketamine as part of your therapeutic work.
Yeah. I thank you so much for asking. This is something I talk about every day and with ketamine therapy and ketamine treatments, and answer many questions from patients about similar, just sort of the unknowns. And so for me, it dates back to being in residency. Actually, I trained at NYU, and during my residency training, they were doing psychedelic research, primarily with psilocybin. And I became very just interested and fascinated in the impacts that psychedelics seem to be having in, relatively small studies, but just how impactful they could be. And, at the time was just thinking, well, that's a pipe dream. Someday that might get approved, and that may be a part of one's, work and therapy and in career. But I was connected to a couple of researchers, and one of whom became a mentor of mine, who was then trained to do ketamine treatments in private practice and ketamine therapy, specifically ketamine-assisted psychotherapy. And I will admit that sort of the outset of that, I was a bit of a skeptic with respect to ketamine, in part because of my own biases. And, I was kind of the person who was like, isn't that for anesthesia? Isn't that for like a club drug? Or, some other patients will say, like, isn't that like a horse tranquilizer or for
Yeah.
animals use? And so I admittedly was a bit of a skeptic, but through trainings and actually through mentorship was able to both learn, and then in my practice actually see how impactful it could be for people, and really how transformative it could be for certain people, not for everyone, but for when it's used in a sort of judicious and appropriate way, really how impactful and transformative it could be. And so ever since then have just like continued to have an interest and be amazed at the impact that it can have.
Now, so I want to get into right what it looks like and how you conduct a session like that. And from what I understand, that there's several weeks that it's applied and used, but you'll tell me more. But I guess I've been thinking about it in terms like how does it differ from being in a hypnotic state and helping somebody dive into their past. And maybe I'm getting ahead, really just kind of
Mhm.
having random thoughts about what I've understood this to be, or how I'm trying to understand how this works, right? Having an induced state to help somebody get in touch with certain emotions or feelings. But I'm going to turn it over to you, and you can just tell me about how that looks.
Yeah, yeah. And I'd say that it's probably one of admittedly, I would say ketamine therapy and ketamine treatments can be the landscape can be a bit confusing and it's so broad because, even as I was mentioning before, ketamine, the range of, I think, experience that people are aware of goes from anesthesia, where somebody's totally unconscious, obviously, to use it recreationally where somebody's totally conscious and just has like a bit of a buzz or a high from it. And so, how do you connect those two things even? And so really it's the impact and the experience someone would have is really highly influenced by the way in which we use it, the route of administration is what we call. So whether it's given through an IV or intramuscularly or under the tongue, there's a lozenge form. So Spravato, which is a sort of a part of the ketamine molecule that's approved by insurance, that's an intranasal form.
Hmm.
And then also the dose. So you can
Mhm.
imagine ketamine is a dissociative, and so it can induce a bit of it's not dissimilar at certain doses to what I think you were mentioning, a hypnotic state or a dreamlike state. And then sort of as one goes higher and higher in dose, that's when it becomes more and more dissociative. People can have more psychedelic experiences. And then obviously going higher and higher, it could be used for anesthesia. The doses that we use and the range is much, much lower than what's used for anesthesia. So it's, that's usually 5, 6 times the doses that we would be using for mental health conditions.
Is the dosage determined before the treatment begins, or is it something that can be controlled by the therapist as the client is in the state that they're in?
Yeah, so usually we determine the dose beforehand, or almost always we would determine the dose beforehand. And that is really primarily guided by research and evidence. So the sort of the foundational research for ketamine treatments started in the early 2000s using IV ketamine, and in particular for individuals with depression that had not responded to other forms of treatment, medications, psychotherapy. And the very initial study was that researchers did one infusion, so an IV, over about 40 minutes of ketamine that was a weight-based dose, so zero point 0.5 milligrams per kilogram. I know this is getting into when it's America, so we don't use
It's okay.
milligrams or kilograms often, but basically they determined the dose beforehand, gave one infusion, and noted that people had really rapid and marked improvement in depressive symptoms, and also a reduction or an alleviation of suicidal thoughts if they were having them before. And they found that then the impact of that was relatively short-lived. So one infusion would have that sort of an impact for days or maybe a week or two, but then fade away. And so a lot of the research since then has been trying to determine how to be able to prolong and sustain that effect. And so ultimately what was landed on is been to do a series of infusions, or a series of treatments, I should say, because there's different formulations or different routes
Yes.
of administration, as I mentioned, to basically build upon and maintain the initial response that someone would have.
Okay. So I don't know whether to proceed with that or like there's information we need before that, right? Because
Yeah,
so I've
yeah.
met a couple of people recently who have encountered this and have experienced this. I think the average was like 7 doses or seven
Mhm.
times, 7 treatments. And what they got out of it was greater insight. So it
Mhm.
wasn't really about symptoms of depression. And so that's
Yeah,
one question too, right? Like I know
yep,
this is used for anxiety and other diagnoses as well.
yes.
which maybe you can enlighten us about, but also the idea of like getting in touch with our unconscious
Yeah.
processes that helps to move forward the therapy. So
Yeah.
there's a lot in there, but maybe you can
Yes.
help
Yeah.
sift it out, starting
Yes.
with who is this used for potentially other than, depression, and how your conceptualization of its utility and
Yeah.
application,
And
determination about who you use it
who
with,
would be
when you bring
appropriate?
it into the treatment.
Yeah.
Is this just like an encapsulation of a much longer treatment? So this is like a period in time. I'm gonna
Yeah.
stop. I'm gonna
Yeah.
stop because it's so curious.
Yeah. And it's I would it is so complex, I think. And so the reason I mentioned before about just the initial research and studies about sort of the medicalized version of it is that sort of the where all things started. And it was really perceived and ketamine was seen in this really just narrow medicalized way. And as people then were receiving treatments, that's when we were finding that people were having these really deep and meaningful experiences during the sessions themselves and even afterwards. And that can be a tremendously helpful part of the therapeutic process. So it's historically I would say that by and large, the most sort of clear use for ketamine treatments or ketamine therapy is in the context of depression when it's used in the sort of more traditional way of ketamine infusion therapy, so the 6 treatments over 3 weeks. Even in that context, it's not, just, oh, this is an antidepressant and, you take this and you'll get better. It's often really is deepening therapeutic work. And one of the things that we really consider a lot is the readiness that someone has as well to be able to really be open to deepening the work and open to the things that will come up. Is somebody already in psychotherapy and what are they working on at that time? A lot of times when people are coming to consider ketamine treatments, it's not only that they're, say, not responding to medications or that they're sort of at a place where they're just severely depressed and still not in therapy. Or a lot of times it's actually therapists referring patients where there's just a stuckness that they're at in therapy, or there's sort of awareness that patients and therapists both have of like, we're on the cusp or we kind of keep getting almost to where we want to go, but we're really not getting as deep as we would both like. And that's something that often ketamine therapy can help people deepen the work and just have, I would say, connect to deeper parts of themselves and emotions that are otherwise sort of, I think our defenses are pretty good about blocking off. And
Yes.
that's where it really is within the context of therapy can be tremendously impactful.
Okay, so I want to get into, of course, what this looks like, but just a point of clarification. So I think you indicated that therapists are referring to you to provide the ketamine treatment kind of as a supplement to their own work that they're doing, or are you a ketamine therapist so that you have clients that you've been working with, for periods of time and decide to administer ketamine and to
Yes.
deepen the process?
It both. So I have I guess one thing about my background is also I was in private practice and doing ketamine therapy with clients. And then when I joined Being Health as the medical director, I'm now overseeing kind of somewhat of a different method of the use of ketamine, where I'm not as involved in the ongoing therapy during the sessions, but I previously in private practice and in my therapy practice, that would very much be a part of the treatment process.
So when you're doing
And
it
so it's
at
a bit
like,
of both.
sorry, okay, thanks. So when you're doing
Yeah.
it in consultation, is the therapist sitting in on the session with you and the client?
That can be the case. At Being Health, we haven't had that. Primarily when using higher doses of ketamine, this is where I would say the dose that we use is really impacts the structure of the treatment.
Okay.
So at higher doses, when people are getting say ketamine infusions or intramuscular ketamine treatments typically, then it's so dissociative that people aren't actually, it would be difficult to talk during in the midst of the infusion itself. And so often the therapy session will be the next day.
Okay.
And
Wow.
we're on lower doses, but we just to mention that we have a clinician in the room with patients at all times during here, just because a lot can come up, and we also want to make sure that people feel safe during the treatment sessions, even if they're not actively engaging in therapy during. But it's often sort of during those sessions that people come to realizations and come to determinations or have been really impactful experiences that they're able to talk about or journal, especially, and then speak with their therapist about the next day. On lower doses, so this isn't a form of ketamine therapy that we do here at Being Health, but it's a not uncommon form of ketamine therapy in the therapeutic world. I'll say like Journey Clinical is an example where therapists will may have patients take a lozenge, which is a lower dose of ketamine, and it's just we'll say mildly dissociative, where that just is sort of breaking down a bit the barriers that may otherwise keep someone from kind of deepening work a little bit in therapy, and then
Yes.
can be doing therapy during the session itself.
Yes, I understand all this, and I
Yeah.
wonder how clients respond to this in terms of their understanding or anxiety about welcoming this process. So the best I can do is kind of try and make my own analogy, one as I did to hypnosis, right? And I think under hypnosis, folks generally don't remember, if I'm correct, what their experience was while they were hypnotized, but the person conducting the hypnosis does and then can work with that information,
Mhm.
if I'm correct. Then I think about like being under the influence of marijuana. And I'm
Mhm.
trying to think about like being in that, pre-conscious or subconscious
Mhm.
state where you're
Mhm.
very aware of what's happening around you. You do remember, most,
Mhm.
I think most people remember everything that happened while they were high. And it facilitates kind of a freedom, or as you're saying, a disassociative state, but not disassociative. I think more so, what would the terminology be? You can help me if you know it, but I'm I'm thinking about, that experience of being under that kind of influence of that kind of a substance and how it may compare to ketamine.
People use like liminal state sometimes is a phrase that we'll use,
Subliminal.
or a dreamlike state.
Mhm.
And it is a bit like it is not. It is the case that people almost invariably will remember the experience that they had during the session, during the ketamine treatments or the ketamine therapy, and that is something that people carry with them. It's not so dissociative in the sense that, as you mentioned, as you say, it's not disconnected from someone's memory afterwards, where then the therapist is needing to remember. It's usually people actually, it's profoundly impactful and people remember it quite well. And at higher doses, it can really, or at certain doses, it can, and for certain people, it can really be very much a mystical or psychedelic experience, actually, similar to what you might hear about with psilocybin or LSD.
Mushrooms
Hmm.
or something.
Yeah.
Yeah. Okay.
Yeah.
So can you give me a sense of a client and, from start to end in terms of how this opened up pathways to be able to work on in therapy, and how you
Yeah.
prepared the client for this and got them on board and all of it.
Yeah, yeah, and I can speak about someone who I think is useful in actually showing the different ways in which we could use ketamine therapy and at different sort of at different circumstances for a given person and in different circumstances for different people. But he's a gentleman that I've seen for several years now who was very, very chronically depressed. He's in his 60s, had early childhood attachment trauma, also has had really chronic depression and not wanting to be alive, and has really taken many medications over the course of time. None really were particularly impactful. He had been in therapy for many years and really came to me, was referred by a colleague, and came to me really pretty severely depressed and just feeling like there wasn't a point in living. And at that point, my feeling was that we began therapy and medication management relationship essentially, with the idea that we may start doing ketamine treatments, which we then, the initial phase, I would say, of the incorporating ketamine into the therapy was that we sort of went through the more traditional way of doing twice a week ketamine treatments at the doses that are used for pretty severe depression.
Yes,
Um,
but can I
mhm.
pause you for a second
Yeah.
and just ask about the client reaction to it? Because I believe Matthew Perry died of ketamine, right? And
Mhm.
we know that that was, self-imposed. Self-imposed, that's not fair. But self-administered. Okay,
Yeah.
right? Not under the care
I
of
think it
a
was
therapist.
administered by his assistant. But
Administered
yeah,
by his
yeah,
assistant. Yes,
but
exactly.
not under the care of a clinician. Yes.
Exactly. And but that to the layperson, that's the exposure to ketamine, right?
Yeah.
These tragic incidents that we hear about. And so even though, we tend to trust our psychiatrist or our therapist that we're working with, hopefully, I would think that that looming fear of like when somebody goes and does get an operation and goes on anesthesia, many people have fear like, what if I don't wake up? Or what if
Yeah.
something terrible
Yeah.
happens, right? So the general and when we can use this patient that you're referencing as an example, and maybe it's even I'm answering my own question, but the idea of somebody being so distressed or so unhappy that the impetus to try anything, right? Like
Yeah.
I knew somebody who was after battling depression for a long time, not being able to understand its roots and not being able to work through it, elected
Hmm.
to go for ECT, right?
Hmm.
Which we also don't hear much about these days. And what
Hmm.
we have heard about is like one flew over the cuckoo's nest, right? Really
Yeah.
like scary
Yeah.
stuff.
Yeah.
So I guess the sense of desperation, I would assume on one level, is what propels somebody to want to try something like this. But are there or is there an example of like someone being really, really fearful of this and kind of having to work through that in order to get to the point where you can administer the ketamine?
Yeah, and I think it's people have often a lot of fears about what is the experience or what is it going to be like,
Right.
basically. People can be afraid that it might become addictive, for example, that they might, and that's something that we very much are using Matthew Perry as an example. That's not someone that I would have pursued ketamine treatments with because of his really severe history of addiction that he was very open about. And it's something that we have to be very clear about what the intention is and what
Mm-hmm.
the impact is,
Mm-hmm.
whether there is a sort of a desire to be in that state and
Mm-hmm.
it not translate into improvement, say, outside of that state, if you will.
Right.
And that's something that I'll mention even in this client that had come up during one of the ketamine treatments that we then it was so helpful to be in therapy with him that we then were able to really talk through that, where he was mentioning, I feel so good during these treatments and then it fades away. And so I kind of almost look forward to them in a certain way. And we really talked through that in a lot of deep work and therapeutic work about what that means. And also then whether, the conflict around that. And it really just reinforces, I think, the importance of really helping to prepare someone and answer all the questions that someone might have. And also for as a practitioner to be comfortable with someone to pursue or to decide to do ketamine treatments. It's not I would say other fears that someone might have also in that circumstance is that it doesn't work, the worry that it's not going to be helpful, or I would say equally as important that we talk about beforehand is this is my only hope or this is my last hope. And the
Mm,
degree of
mm,
putting this is the only thing. I think,
right.
it may be as a clinician, sometimes we're put in the position of like, you're my only hope or you're the sort of
Right.
the end of the road. And that is a very difficult place both for that person and for us to be in, where if it's not meeting the expectations. And so we really need to talk through what someone's expectations are and what realistic changes might be happening. And also, what if it doesn't work? Or what if it
Right.
doesn't, rather, what if it doesn't meet one's expectations, I should
Right.
say.
It's so interesting to hear that, right? Because as you're talking about that, I'm thinking about my own response and consideration for another layer that people may contend with, which is the idea of the loss of control, right?
Mhm.
The
Yes.
on a couple of
Yeah.
levels, right? The loss of control that this is being administered and I don't know what's going to happen, and just that I'm not in control of the situation. So, what's going to come up, that
Mhm.
layer as well, like
Exactly.
and I can't control. And for people who are so defended or have their coping mechanisms or whatever,
Mhm.
I could see that is scary as well.
Yeah, and I that's a very, very good point, and something that I've seen where, particularly in the circumstance, was I say of OCD, where a higher dose of ketamine treatment can be incredibly distressing, actually,
Right,
because of the exactly that, the loss of control.
right,
And that's something where the understanding the sort of core of what someone's experience is and what the impact of ketamine might be, then it may not be the appropriate choice initially, or it might be if it only in the context of a very, very, very low dose, for example, in the context of psychotherapy or just being utilized in a very, very different way, perhaps.
right.
So yeah, it's really needs to be highly tailored and personalized to what someone's own experience is. I'll mention also with trauma that it's something that we in PTSD, you mentioned that as one of the applications, and it is very much in research that has been studied for PTSD or in PTSD. And at the same time, it's something again that we want to be very, very cognizant and careful about because traumatic memories and experiences may come up during those sessions. And especially as you mentioned, the loss of control can be really terrifying.
Right,
And it can be destabilizing.
right.
And so it really then reinforces the importance of having supports and having therapy in place and be really doing it in a way that is so personalized and tailored to that person and
Yes,
often slow and not in the sort of trying to get better quickly,
right.
that actually is something that can be destabilizing, as I mentioned, with some patients.
Right. So the idea of this is more about getting to be able to uncover areas of stuckness or to get to a deeper place to be able to work through something rather than expedite the treatment. Right?
Yeah.
Let's make
Yes,
it clear.
exactly.
Okay.
Exactly.
So
Yes.
let's go back to this gentleman patient of
Yes,
yours.
yes.
Yeah, so I'm sorry. I got, it's just
No, I'm
also interesting.
I'm
Uh,
I myself was on a tangent. So he and I ultimately decided to pursue the ketamine treatments and in the context of therapy. So I would be seeing him twice a week for the ketamine treatments, would be in the room with him, and then we would be I think these were 3 hour sessions and doing some therapeutic work towards the end of the sessions each time. And did the more traditional sort of set of twice a week for 3 weeks, which is what sort of research has shown to be helpful for treatment-resistant depression. And sort of through that, we were able to uncover a lot, actually, both from work that we would be doing in psychotherapy, sort of deepening. He was somebody who was extremely spiritual and so had experiences that felt deeply spiritual and meaningful and sort of strong connections with God and meaning the experience of sort of the presence of God, we'll say, not him being one. And so I always give that as a clarification as a therapist. um,
Understood.
but yeah,
Yeah.
may not be necessary for the layperson. And then through that, what we also had sort of were able to get to a place where he wasn't so, his functioning was better, than wasn't so acutely depressed, but really then became clear how a lot of the trauma that he had experienced in early childhood had remained unresolved and were continuing to contribute to the just lack of, or the passive suicidal ideation that he had, the sort of chronic low-level depressive symptoms. And so that then led us to elect to do ketamine therapy at a lower dose or a much lower amount, where we would then be, I should say that one of the primary things that we had sort of realized or uncovered was his own disconnection from his own emotions. I remember vividly him saying, I know there is so much joy and love in my life, and I don't feel it. I know I like my friends love me. I know cognitively that I love my friends, but I just don't feel love. I don't feel a lot of emotions. And I recall him describing, and it was one of the most vivid descriptions of dissociation that I've heard, where when he was a child, he remembered things in his upbringing were so chaotic and distressing that he recalled laying on the ground and he would feel himself almost, or feel part of him, his being lifting out of his body, starting with his fingers. And so he would feel like he was sort of floating above his body and not being in his body and in his emotions, and basically so that he didn't have to feel the sadness, fear, etc. And that had been something that had largely continued for a lot of his life. And so then the therapeutic work that we began to do was really helping him become more embodied and in touch with the emotions that he had really defended himself against for a long time. And it was extremely challenging sort of trauma work that we were doing, connecting to shame and hopelessness and helplessness. And counterintuitively, I will say that ketamine, although it's a dissociative, helped with alleviating the dissociation that he had, sort of alleviating the disconnection rather that he had from his own emotions over a long time. And I think that
Well,
has to do with, yeah. So
no,
I know I said a lot in a
no,
short.
maybe you're going towards this because my question is, did the ketamine allow him to get in touch with that memory, or was it the connection with how he was physically feeling being on ketamine that kind of tapped into that
Yeah.
same bodily experience earlier
It
on?
it was the what he was experiencing during the memories he could recall, even outside of the context of ketamine therapy, he was able to recall those memories. It was, I would say, the two things that seemed to be the case was that when we were using ketamine for therapy, it was while on, how would I say, the physical sensations and those emotions, I think in some ways became a bit safer to
Mm.
be able, and safer in the context of the therapy, and safer, I think, even in him being able to, like the defenses that he had being
Mhm.
sort of slightly dissolved enough to be able to connect with those emotions. And then the physical sensations that were, I think, connected with those experiences as well. That was something that was very profound. The like feeling of just the somatic experiences that he would have during the sessions that were so clearly tied to those intense emotions, and also the experiences that he had had when he was younger.
And so, did you ever have the experience that somebody goes through this, right? Uh, you develop such insight that allows the work to propel forward, but it becomes so overwhelming or so scary that the person goes back to their defenses after the ketamine treatment and shuts down and doesn't want to explore this.
It's been the case that those, and I think I would say that has been the case I've seen in therapy without ketamine treatments as well. When we sort of get to a place where we've tapped into something, I think I remember one of my therapy supervisors saying, like, I forget exactly how he said it, but it was like when you have a breakthrough in therapy, or like somebody's gonna really, you get to like a really new deep place, don't be surprised if the person cancels the next week,
Right,
or
right, right.
but which is to say that it's, I think in some ways a natural, or in some ways not an uncommon experience where those defenses in a way get reactivated and recharged.
Right.
And that's something that we, again, is a part of the process in therapy where it's just managing that awareness and that sort of,
Yes.
we as therapists know that the healing is not linear, very much so. And it most certainly can be the case that that happens. And I've seen that in other contexts too. But I will say I haven't had it be the case that someone, I'm sure this has happened, but where someone then elects to not continue the ketamine therapy as a result of that specifically.
Gotcha.
Um, yeah,
Gotcha. Well, because you're making sense that, you either
yeah,
have that defense or you don't have that
yeah,
defense, right? You either break through that or
yeah,
you don't.
yeah,
Um,
yeah.
just an aside, you have a very hypnotic voice. Is
Oh,
that by is that by coincidence?
it's yes, I
Or is
guess
it
so. It's not, I'm not intending to hypnotize anyone.
No, I don't mean that. I just mean like I wonder if there's a certain calm, that you kind of get into as you are
Oh,
administering this and working with a client to help them diminish their anxiety and
yes,
uh,
yeah. I think that is something that I've unconsciously or subconsciously has happened over time. Yeah.
adopted. Yeah,
But
that's so
yeah,
interesting. That's
yeah.
so interesting. So, what surprised you most in your work with ketamine therapy?
I'd say a few different things actually. One is that I've been a bit surprised by one thing that I mentioned before, although something that seems so counterintuitive to me that although it's described as a dissociative, it one of the impacts that it can have is actually helping people to reconnect with deeper parts of themselves or get to places that are deeper emotionally, which seems a bit counterintuitive, but has been very common in seeing patients with and how impactful that can be. I think I also didn't appreciate, how would I say, the sort of the psychedelic-like experiences that someone might have, but really just I don't think before I started working with ketamine how I did not realize how really strongly therapeutic the experiences that someone can have during a ketamine session could be. One thing I'll mention is that I really strongly try to manage the expectations that someone might have around what experience or ketamine session might be because I'd say it's a bit like trying to predict a dream. I really don't know
Mm,
what will come up, and it's something that if something does, that's great. But we work with it in many ways. And I mean, there's therapeutic value in even someone's experience of the experience or their expectation of the experience or their analysis of the experience. There's a lot of layers to it, I would say.
right, right.
Um,
I wonder how ketamine was determined to be the drug to use in this fashion. And maybe I'm fixated on marijuana, but I'm thinking about like, can
yeah,
marijuana produce something like this as well?
I would potentially. I guess I could imagine that being the case. I think my impression is that, or my presumption is ketamine has sort of been a beneficiary of the way in which our medical system works, where if a medication is approved for,
Right,
it's the fact that it has been FDA approved for so many
right,
years and it's already sort of available within the medical system means that we're able to utilize it within the context of therapy or medicine more easily than with marijuana or other psychedelics that aren't even approved yet.
right.
And so I think it's been in
Well, who
some
knows
ways
where this is going to lead, right?
yeah, exactly.
Yeah,
So this is where we're at now, and I think it sort of shows the potential for how similar medications or similar thing could be utilized,
yeah.
and both the importance of tailoring it to each person and to be really judicious and careful and how to incorporate it potentially in therapy.
hmm And to be able to do that, how do we go about it? So how can therapists responsibly begin to learn about and integrate these approaches?
Yeah. So I would say that there now one great thing compared to when I started or when I was trained by the mentor that I mentioned for ketamine treatments, that was in, I believe, 2020. And at the time there were very few trainings. There was very little information out there, I would say. But since then there have been a whole host of new training institutions. There's now a governing like membership body that is similar to the AMA that is for ketamine treatment providers.
Hmm. Hmm.
And there's a lot of educational or a lot of professional education that
Hmm.
can be done. And that's something that I would suggest that has been, one has been very helpful to me. And I think is a great starting point for people to learn about it within sort of a clear, basically from experts or from people who have been working in this way for a long time.
Yeah, sure. Sure. So let me just ask you, how has this work changed you personally?
Yeah. I would say that it has had a profound impact on me. I think on a very on a very basic level as a doctor, it has made me so much more open to new ways of thinking and new ways of understanding how someone might be able to just, I will say, it has made me so realize how little I know and how little we all know, and has made me appreciate actually really profoundly how strong of a drive inside each of us and how strong of a that there is a very deep place in most of us and rather in all of us that is really that when we're able to connect to it is really very healing and is ultimately the source of our well-being and sort of our, our life force in a way that it basically has made me realize how within each person, even as someone is experiencing depressive symptom, TTSD, that the a lot of those things are covering up
Yeah.
what deeply internally is actually someone who is able to experience all of the joys and love and all of these things in life. And so it's made me very hopeful about being able to do that work with so many different people and for myself as well, that helped me apply a lot of those same learnings to myself.
So, but when you say how little we all know, are you talking about
Ah,
self-awareness?
I would say rather how little we in the I guess I mean when I was in residency, the idea of using psychedelics or the idea of using ketamine in the context of therapy was not even remotely a possibility or is just sort of
Right.
unheard of.
Right.
And it just has allowed an exploration, I think, or an understanding of our mind and our emotions and where we derive meaning and how to access those things in a way that I was really hard to appreciate before doing work like this and has just made me very, very grateful and also frankly has made me even more appreciative of the work of therapy itself,
Mm,
because I really see ketamine as a facilitator of therapeutic work,
yeah.
and a deepener of it rather than it being something that stands alone separate from that.
Yeah, but what I take away from that is how necessary it is to be open, to be flexible in our work, right? To be
Mhm.
creative, and to keep learning ongoingly. That this is not a profession where it stops, after you adopt a particular method or approach, right, to treatment, and that, as you had kind of alluded to many times during this episode, is that each individual is unique and each individual requires tailored treatment, right? Whether
Mhm.
it's in terms of thinking about ketamine and dosage or the
Mhm.
when to administer versus, non-ketamine assisted therapy. And, a one-stop shop just doesn't work, right? We have to be able to adapt and be eclectic, I think, in our work, depending on who is before us, what their desires are and what their presenting issues are. So it's a very kind of
Exactly.
complex um, profession. And
Yeah.
I think it's really cool that you started out kind of a little bit more I mean, if we're going to put a label on it, just the word that comes to mind is rigid, right? And our thinking about what this looks like and how psychiatry for you, for example, works, right? And you've really kind of broadened, your understanding anyway. And I think that that's wonderful. So if you could leave listeners with one takeaway about healing, just one, right? Or if you have two, what would it be? But no pressure, just one that's going to make such an impact. Yes.
I would say that I would go back to kind of what I said before, is that just to give some sense of hope, is that it really is within each of us. That healing work, while it is so helpful to have and really necessary in a lot of circumstances to have professional support, the support around us, that it really ultimately is work within ourselves that we're able to do, and that it's uncovering what is already there. And I think that is something that has been beautiful to see over the course of the work that I've done, and has given me a lot of hope, and hopefully will communicate that to the audience as well.
That's awesome. I'm tempted to try it. It's very curious. And I also feel like certainly if one is thinking of administering it, which I'm not quite at though, but I'm just saying that if one is, you really have to undergo it yourself to understand. Just like, I mean, I'm a strong believer in the necessity of any therapist being in their own therapy, right?
Yeah,
so you gotta understand what it's like to have some of these experiences, even though obviously we can't have all the same experiences as our clients, but just to know what treatment feels like.
It gives a tremendously helpful context to what you would be putting someone through, or what somebody would be experiencing. Absolutely.
Dr. Hudson Elmore, psychiatrist, medical director at Being Health in New York City. So appreciate you taking us through this, and also deepening my understanding very much so about ketamine-assisted therapy. So thank you so much.
Thank you so much for having me. It was so nice to talk.
Thanks for listening. I really do appreciate it. If you like what you heard, please consider leaving a rating and review on your podcast platform, and don't forget to subscribe so you don't miss my next episode. If you're struggling with clients, I'm happy to consult or provide supervision. Consultations are also available for any person listening. If you're struggling with sibling abuse, you may want to join my sibling abuse workshops. I'm open to feedback on topics you'd like to hear or questions, so feel free to email me at drmeyerspod@gmail.com. You may be interested as well in checking out my blogs on my website at amymyersphd.org.
I've got some problems, I've got some questions. I need some help, point me in any direction. Clinical guidance is what I need to help me become who I'm meant to be. I've been searching for a teacher, another point of view. And I've been asking myself, what would Dr. Meyers do?